Welcome to American Indian and Alaska Native Living. I'm Dr. David DeRose. Today we have got, an exciting show lined up for you. I'm extremely excited about it, and I know that you will be too if you've been tracking along with us in previous episodes of the show. If you're new to the broadcast, just tuning in today, we've been speaking about one of the great challenges facing the Western world. It's something that's prevalent in Indian country, but prevalent in every segment of the North American population, and that is the challenge of putting on extra pounds and actually putting that in your past as far as not something that defines you, not something that holds you back from really achieving optimal health. So we've been speaking about it in some of our recent programs. Some of you know, if you're regular listeners, that we've recently released a program. Well, actually, we're launching it. If you're listening to this broadcast, on February 4th, we're launching a program called Fast 8. We're talking about some different weight loss strategies and looking at it in a very different perspective over the course of 8 weeks. One of the people that I've been indebted to is I've been, again, looking at some of the literature on helping people change their history is a doctor by the name of Jason Lillis. And the really good news is Jason is actually in the studio today with me, our virtual studio. Dr. Lillis, it's great to have you with us today.
Thanks for having me.
Jason, I learned about your work actually through the lay press. You came out with a book a while back called The Diet Trap. And as you and I were talking off air, I love the subtitle, Feed Your Psychological Needs and End the Weight Loss Struggle Using Acceptance and Commitment Therapy. I know that's a mouthful. We want to talk about that on today's show. And just by way of background, Jason, you've got a number of academic affiliations. You're a researcher. You've been writing books in the lay press. Tell us a little bit about your background.
Yeah, sure. I got my PhD in clinical psychology from the University of Nevada, Reno, and I worked with Dr. Stephen Hayes there. He's actually one of the originators of the treatment approach I use, which is called acceptance and commitment therapy, said as one word, ACT for short. So that's kind of where I come by my treatment approach. And then my interest in health behavior change generally and weight specifically is a personal interest. Got some good advice from that mentor of mine back in the day that if you're going to do research, you really should pick something you personally care about because it's a hard road to do research and get studies off the ground and finish them, a lot of work. So I have a personal interest in health change and weight. Almost everyone in my family is obese in terms of my immediate family, and or with obesity is the proper way of saying that today. And I myself have gone up and down the weight scale and wondered why I've been on that roller coaster, most of my life. And so I come by the work honestly. So I've applied ACT in this area for as far as I can remember now, I think we're up to about 13-ish, 14 years or so. And that took me to Providence, Rhode Island, where I got a job working at the Weight Control and Diabetes Research Center, which is a joint institute of lifespan health, and the Brown Medical School. And life took me back to the West Coast, so I remain part-time in that position, and now I also work at a university, California Northstate University, but I continue to do health behavior change research.
So it's exciting to have you with us, Dr. Lillis. So you've got an associate professorship at Brown University at the medical school there, and at Cal Northstate University there in the Sacramento area. So we know you're well grounded in the academic arena, but what I love, sometimes you deal with folks who are in academia and they're just out of touch with what's happening on the ground, but you're really working, one-on-one with people. You're doing research. It seems like I just ran across a project that's ongoing, and one of the, I think I saw, a paper talking about the design of a big study you're doing in this area. Did I pick up on that correctly?
Yeah. Yes. So if you're talking about the one that's happening up at Fred Hutchinson up in Washington, then yeah, I'm involved as a consultant on that, as well as Jonathan Bricker, an Evan Foreman's grant looking at a telehealth intervention using ACT for this health behavior change weight control. Yeah, and I've always in my research, I've tried to keep a clinical role, even a small one, so that I can continue to work with individuals usually in group settings, and not get too far up that tower and too disconnected from what's actually happening.
So we really want to speak about this ACT, acceptance and commitment therapy, and maybe by way of background, a little bit about my background. So I'm a clinician first, an internal medicine specialist, and shortly after my training was completed in that specialty, I ended up heading up a preventive medicine department for a large hospital system, even though I didn't at that time have my boards in preventive medicine or my master's in public health. That all came along later. But in that first role, one of the things I was tasked with doing is helping work with a weight loss program that this hospital system was running in a large urban area. And so, I was there in the trenches just like you were. And one of the things that back in that era was a fairly new concept, at least as it was being applied to weight loss, was something that's now become, kind of, let's just put it this way, kind of everybody talks about CBT, cognitive behavioral therapy, but the counselors, dietitians that I was working with, they were using that model, talking about, in lay terms, kind of reprogramming people's thinking and getting them to re-perceive things and not overgeneralizing and, these different distorted forms of thinking they were addressing. So that's one psychological school of thought that's, of course, been brought to bear in this arena. But as I was reading through your material, looking at some of the research that's been done on it, kind of a very, sure, there's some parallels, but some major differences. Here's the challenge you and I have got, Jason, because we've got a lot of professionals that tune into the show, people throughout Indian country work in tribal health, people outside of Indian country. So we want to speak to them, but we've got a lot of lay folks who join in too. So tell us, first of all, why this is different, why it's different, this ACT than other approaches like CBT or other psychological strategies that maybe people have been exposed to, whether they've heard those names or not, in, let's say, a weight loss program.
Okay, I'll do the best I can in a short time. And I'm going to create a bit of a straw man CBT just for illustrative purposes. Because, just as the way the field is moving, these things are starting to blend more and more to the point where we won't be able to distinguish them 10 or 20 years from now. But if you're talking about a traditional CBT model, I'd say that the easiest way to understand the difference is the traditional CBT model comes from a standpoint of we're going to fix what's not working right in terms of your thinking and feeling, right? And then once that's fixed, you can then kind of live the life the way you want and have more satisfaction, be happier. That's kind of the general. Again, I'm creating a bit of a straw man here, but that's a good way to understand the sort of model. ACT is coming from a different perspective, which basically says, no, nothing that's happening is broken or wrong or needs fixing, right? So whatever thoughts you have is fine. Whatever feelings you have is fine. It's the sort of way we're relating to what's happening in us that's keeping us from pursuing the life we want to live. And so the ACT treatment is focused on essentially giving you the skills to notice your thoughts in a different way, so without changing them, but in a way that gets you less stuck in your life, right? And it gives you some tools to open up to your feelings in a way, not that they don't hurt anymore, because of course when you're sad that hurts, when you're depressed, when you're anxious, you experience that negatively, but experience those things in a way where all of a sudden now it's not, again, getting you stuck or holding you back from pursuing something that's really meaningful or important in your life. So I think that the big distinction is between once, with ACT, you start at a standpoint as everything happening inside you is okay, is normal, is human, is understandable given your circumstances and your history. And we're going to sort of give you the tools to learn how to live with that and move forward and pursue things that matter. The other traditional model is these are symptoms of, a disorder that we need to treat. And once we treat those effectively, then you can go on and live your life. So I think that's the big difference in terms of the models.
So what I appreciate is you're, basically talking with us about how you see, all of these disciplines kind of growing, coming together. We're looking at different aspects. So this is not a program that's designed to put, one approach in a negative light or another approach in a positive setting and say, hey, you better throw out, any techniques that have helped you. But we're trying to look at something that, to me, what really connected, I will say, Jason, as I read through your book, is a lot of the opening illustrations, and one that I think resonates throughout Indian country, whether a person has weight challenges or not. And maybe I should pause right here. We're not offering this show on American Indian and Alaska Native living because weight issues are something that's a particular Native problem. And I know sometimes people want to generalize and make value judgments about people of indigenous backgrounds and things that may relate to weight, may relate to other things. But we're looking a lot at this whole topic as we look at ACT, kind of the shaming and blaming and some of these things that a person who's might be at their ideal weight in Indian country, they still can relate to some of these things where people have pointed at them, pointed at their appearance, maybe because they're Native, maybe because they grew up speaking an indigenous language, whatever it was, however they experienced discrimination. And a lot of, as I listened to your book, these opening stories talking about people who feel defeated, they feel like they're continual failures. Speak to us a little bit about that. Someone who's listening right now, Jason, they want to turn the station off. They're saying, hey, listen, I don't need to hear any more about weight loss. I just fail at this every time people talk with me. I see how bad I am. What is this? Why is there this acceptance in the terminology of this treatment approach?
Right. So, one of the things about body shape and size is, it's not concealable, right? So if you're out in public, people can see you and your body and your shape. The stigma against people with a larger body shape is extremely widespread. It develops young children. So I don't know how we transmit this, but we get this into the heads of 4- and 5-year-olds to the point where they prefer almost anyone as a friend to someone who has a larger body shape. So imagine how that seeps down that young, that early. It just means it's sort of systematically widespread. And it is still to a degree socially accepted to stigmatize a larger body shape. Now that is very slowly changing, but I emphasize very slowly. The other part of this that I think is really important to point out is the dominant sort of media promotion of why our waistlines have expanded, and generally speaking, as a world, we weigh more, has been to highlight personal failings, things like willpower. There's not really a lot of evidence that really plays even an infinitesimal role in what's going on. There's a lot of potential explanations. That's probably the least likely. So it's sort of built in. So from very young, there's a stigma towards a larger body shape. And you get messages that if you have way more, then you likely that's due to personal characteristics and failings of yourself. So it's almost impossible not to internalize that and feel shame and blame around that, whether you're trying to lose weight or you did, and now it's gained it back.
We definitely have to build on this. You've presented a case that a lot of people can resonate with, but we've got to talk about the solution, and that's where we're headed in our next segment. I'm Dr. David DeRose. Dr. Jason Lillis is standing by. We will be back talking with some very practical things that can help you to really actually live a full, productive life, even if you feel your waistline is a little bit larger than you'd like. Some great strategies coming up. Stay tuned. I'm Dr. DeRose. You are back with Dr. David DeRose on today's edition of American Indian and Alaska Native Living. With me is Jason Lillis, PhD. He's an associate professor at both Brown University's medical school out east and out west. He's on the faculty of California Northstate University. He's been working with a psychological technique that's simply abbreviated ACT. We're speaking about how this can make a difference when it comes to you being, able to live a healthy, productive life, even if you seem to be predisposed to put on some extra pounds. Jason, we were speaking in the previous segment that our society is not a good one as far as accepting people who have a little bit larger body type. This stigma starting at very early ages. The other thing that seems to go along with this often is some kind of concept that many people have that somehow if they shame people or somehow, just tell them, get your life in order, stop eating so much, exercise more. If they just give them, these kind of value-laden statements, it's somehow going to help them. Can you help us from the psychological research perspective? I mean, is this really a good strategy?
Yeah, well, I'll give you a clinical example and then I'll talk about the research really quick. We have to weigh people for our research studies, and I feel very conflicted about that for a variety of reasons, because people have so much psychologically tied into the number on the scale, which I think is a real problem in this area that hopefully I'll get a chance to talk about at some point in this conversation. But I've seen folks have near panic attacks stepping on the scale, and it just tells you that is the result of a lifetime of feeling bad about the number on the scale and what they see in the mirror and what they've heard from other sources related to the number on the scale and what they see in the mirror. So I promise you they've received that message. They do not need it from another person. That's one thing. Now, the other part of that is when this has been researched in well-controlled research studies, and they've been done in a variety of ways, but just to give you an example, having people watch a video of someone being stigmatized for their body shape, for example. Individuals will respond to that some individuals will respond to that by eating more. So it, in fact, has the exact opposite effect, which, makes sense because you're inducing a distressing experience. And, and this is, again, I'm not pointing the finger at personal responsibility here. I do not think this is an issue of willpower, personal responsibility. However, when you're distressed, food is a soother. Food can be a soother, right? So if you combine a toxic food environment that we have with a whole lot of stigma towards body shape, it's not surprising that those things can become associated with each other. So it is very counterproductive to, point out someone's weight or talk about it or tell them to kind of lose some pounds. It's more likely to have the opposite effect than the intended effect.
I appreciate that. So as we're looking at doing a virtual weight loss initiative that we're actually helping to champion on this radio show, we're trying to learn from people like you and really support people, let them know that regardless of what they weigh, they can be successful in this program. And the outcome, kind of a crazy approach, and we'll talk about this, but our concern is helping people adopt healthier lifestyle habits that they feel they can embrace. And the end point is not necessarily what they weigh. If they're getting on a healthier program, they're being successful if they stick with the program. So this is some of the messaging that's going behind what we're looking at. Having said that, I want to go back to something that we mentioned in your book, The Diet Trap. If you're just joining us, Dr. Lillis is one of the co-authors of a book called The Diet Trap. The subtitle, Feed Your Psychological Needs and End the Weight Loss Struggle Using Acceptance and Commitment Therapy. And one of the things that was so interesting to me that you spoke about is as we look at this whole topic of, people being stigmatized, people being, degraded, people feeling that way themselves, feeling like they're failures. One of the things that to me was really interesting, and I know you touch on this in a number of ways, and you've got a wealth of experience since you wrote the book some 8 years ago, and that is when someone comes to you or they come to a program or they inquire maybe even about a research program you're doing, and they come with this fear and trepidation. They want to do something in this area, but they're afraid it's just going to be another chapter in a whole litany of failures. How do you address that?
So the main thing is, I talk about this sometimes in the context of my research studies, is my approach is kind of I call it a Trojan horse style approach, which is people come to me often wanting to lose weight. And what I actually want for them is to live a life that's meaningful and satisfying.
Mm-hmm.
And weight loss can be a small part of that and improve health. However, I'm trying to move them off of the number on the scale being an important thing and looking at how healthy habits can empower them to live their life the way they want to live. So that may include no weight loss. That may include a small amount of weight loss. That may include a moderate amount of weight loss, but the weight is almost secondary to, it is secondary to healthy habits that empower them to live their life in a way they want to live. And what I mean by that is, how will improving your food quality, possibly reducing calories, definitely increasing your physical activity, help you be, better in your vocation, whatever you're doing for work? How will it help you be better in your relationships? Does it make you more patient when you can sleep better, when you have less pain? How will this facilitate the things in your life that you deeply care about? And in the process of that, slowly trying to move them off this history of weight being the thing, of the number on the scale being the thing, of all the stigma related to the number on the scale and the body shape being the thing, and try to move them to a different outlook on the whole situation. So success doesn't have to be the number. The success can be defined in some more vital, satisfying, and meaningful ways in all parts of your life.
Now, we're talking about that, and I've noticed, just as I've been sharing with people kind of this vision, some of these perspectives that you just articulated right now, a lot of folks are thinking like, well, why would I want to be on a weight loss program where I don't lose weight? And so what has kind of been your experience as you go through folks on this journey? I mean, tell us a little bit about, you as a researcher, someone who's trying to contribute also to people's lives and make a difference.
Sure. So this whole enterprise, if you will, I don't know what to call it, this research agenda that I've had for some time now, started with the idea of what if we could influence someone's weight without focusing on their weight. And the idea was, the traditional methods for helping people lose weight are really effective, but only in the short term. So for about 3 to 9 months, you can follow the traditional strategies for losing weight. And for most people, you will lose, somewhere between a mild and moderate amount of weight. Some people will lose a substantial amount of weight. It's a low number. And that works for a while. And then it doesn't work anymore. And then your audience is probably aware that people tend to gain weight back. And the idea came from the idea that maybe the problem is actually focusing on weight. Maybe actually part of the problem here is that we're focused on the numbers on the scale, that people tend to come in with expectations about what their body will look like after the weight loss and what number they'll hit on the scale. And most people will not reach that, and failing to reach that in part feeds the cycle of sort of giving up the idea that you have a destination point, and since you didn't reach it, it's a failure, and you give up, and then you kind of return to previous habits prior to. And to me, it struck me as the agenda is a big part of the problem here, because the way we're defining this is actually getting in the way of people making real lasting change. And so I'm all for folks losing weight. I think the assumptions about where that ends and what the purpose of that is, that's the part I hope to work with people on, to kind of shift them a little bit off of their initial assumptions. There's no reason you not to lose some weight, though. But the question is, what is that for? So one of the things I for someone who's really stuck on the number, will post to them, I'll say, okay, so if I just wave can do some magic here, and you've reached that goal weight. Okay, so I've gotten you to that goal weight. My question to you now is, what is it that you're doing different in your life that's important to you? Because surely the goal can't be to reach this weight and then sit in front of a mirror and look at yourself all day and just be happy. There's a piece to that, but that can't be the end, right? That's not what we're doing. Okay, so something has to be on the other side of this for you. Let's figure out what that is, because I think you can pursue that right now while you're losing weight.
This is so helpful, because we're really trying to catch this vision of helping people realize that regardless of how you've been treated in the past, and this is true, like I mentioned, whether it's your weight, whether it's your ethnic background, whether it's the language you speak, whether it's where you live, you grew up on the res and people look down on you when you go into town. There's a lot of parallels with this, and whether you're native, whether you're not, these topics are so powerful in our culture. We're so into pointing fingers, blaming, divisive language and rhetoric, and we're really trying to help you be successful. So we've got a lot more stuff to come. We've got some really practical strategies. We're going to tap into Dr. Lillis's experience on that, and they're things that you really do not want to miss. So stay with us. I'm Dr. DeRose. We'll be back with the second half of the show right after this. You're back with the second half of today's broadcast. I'm Dr. David DeRose, speaking with Dr. Jason Lillis. We're speaking about, something that may not have been on your radar screen before today's program. We're speaking about a new approach that is, I say new. I say it's new because a lot of folks that I deal with have never heard about it, but it's an approach that really, I believe, has a special relevance to what we're looking at as we're trying to give people tools throughout Indian country and beyond to really help them, in a lasting way, to have a positive outlook on something that has been challenging them, something that's been hounding them. It may be this tendency to put on extra weight over the years. We're talking about something called acceptance and commitment therapy. We've been talking about Dr. Lillis's book called The Diet Trap that deals with this approach. One of the things, Jason, that I've worked with is I've worked with folks, whether they're dealing with weight loss, whether we're talking about diabetes or high blood pressure, other metabolic diseases that I've spent a lot of time working with folks on when it comes to lifestyle change, is this whole idea of kind of comes out of my experience with helping people with nicotine addiction. So early on, there was a lot of focus on, when people are going through a nicotine addiction intervention, you really have to have them focused on not smoking. And they're, repeating this kind of mantra, I'm not going to smoke, I'm not going to smoke, I love being smoke-free, et cetera, et cetera. And I think a lot of us, as we worked with things like this, we said, wait a minute, all these people are thinking about is smoking all day long. And the real success comes when you don't focus on what you don't want to do. I know you look at it a little, kind of that same angle, but in a different way. Tell us about weight loss and this whole idea of reprogramming how people think and some of the challenges there.
if I just ask the audience listening right now to just think about anything except a chocolate donut, for example, like just go ahead and think about anything in the world except a chocolate donut, for 10 seconds right now. Go ahead, do it. Don't think about what it smells like or it's flaky or, I'm cheating a little bit here. And I do this with clients, and it's actually really hard to do. There's just several outcomes here. One is can't do it, because it paradoxically, if you asked yourself to not think about something, lo and behold, the human condition makes us think about it more. Some people will say, well, wait, no, though, I can do it. I cannot think about that chocolate donut. And they may even be correct in a short-term period. But often what you have to do is do some kind of hyper-focus blocking out, concentration on some other thing that doesn't allow any room for you to, actually operate in your life, right? You have to kind of close everything off. Well, that's not really helpful too. That's not something you could do 24 hours a day. And the research is pretty clear on this, is if you try to do that, even if you're successful in the short term, it's going to come back, and likely it'll come back more frequently and stronger. So it's a bit of a rigged game if you're saying, one of the ways I'm going to tackle this problem is to just stop thinking about food, or stop having food thoughts, or stop thinking about, stigma and how I've been hurt. I mean, a good parallel to this that's not is kind of trauma. If you think about people who've experienced trauma and how dealing with that can often involve a really and strong attempts to forget or rid yourself of that experience in a way that you're trying for it to never come up, right? And often people's lives can get fairly narrow in an attempt to do that, to block out all the kinds of things that could remind them of that experience. This is, we're talking about food is not a one-to-one comparison to that, but it's similar in kind in the sense that you won't be able to make that go away for good forever, erase it. There's no tool we have to go into your mind to get those memories out. So you have to find a different road forward that includes, if we go back to now health, thoughts about food that includes feeling shame sometimes, but in a more sort of open way to it, not saying, yes, I should be shameful about this, but recognizing I am a human who's had these experiences. So of course I feel the emotion shame, and I can move forward carrying that shame with me. So we're kind of programmed to think the thing to do here is change and get rid of the stuff we don't like that's going on inside us, when in fact the research kind of tells us, well, A, that may not work very well, B, that may make it worse in a way.
So a lot of these things, as we've been talking in this show, can lead us, as we look at our past, look at our present, to demean ourselves, to put ourselves down. This concept of acceptance and commitment therapy, one of the terms that kept coming up is loving yourself, valuing yourself. Tell us a little bit about, how that happens, why that's so important when it comes to behavior change.
Yeah, I think when you're oriented towards, health behavior change as a means of kind of just life improvement, as opposed to, trying to combat the stigma that you've experienced, or, reach a weight on a scale. I think that really has to start often with body appreciation. We are so trained to look at our body and find the things we hate about it. I think that's, from the get-go, when we're very young, we're taught about what's an ideal and what's not, and everything that doesn't fit, we've been with ourselves our whole life. So we've been able to see those things and judge them, and we internalize that from society, culture, and things. So I think, starting with body appreciation is really important. Your body works tirelessly for you, until it can't anymore, and for all of us at some point it won't. But while it does, it's working tirelessly, and it does everything it can do with whatever we give it. I know that the choices I've made with the kinds of foods I've put in my own body, my body should be pretty mad at me for some of that, but it does the best it can with what I give it. It does the best it can with the lack of sleep that I provide to it. It should be getting much more. That's my kid's fault, not so much my fault, but nonetheless. And it works tirelessly, 24 hours a day to keep the system running the best it can, and it will until it can't run anymore. And so, one of the things to start with is just the idea of looking at what our body does for us tirelessly on a day-to-day basis and start appreciating it for that.
You have this great exercise in the book, because some folks are listening, they're saying, I hate my body, but you actually challenge people to start thinking about their heart. And are you, to be thankful for your heart, to be thankful for your digestive system. And what's interesting to me is even as a physician, I don't have people typically coming in telling me things they're thankful for. They're talking about the things that are problems. And, we're talking about something that's visible. We're talking about something that's been the object of shame and blaming. So I'm really curious, when you walk people through that exercise in real time, not in a book, when you're saying, I want you to cultivate gratitude, to think about things that you're thankful for about your body. What kind of response do people give you as you do that in, let's say, a clinical setting?
Mixed. It's a mixed response. Some people will respond very positively to it immediately because it will unlock this perspective that they have been unable to take up until this point and haven't been able to see it from there. Some people will push back strongly because the societal message about us looking at what's quote unquote wrong with our body is so powerful, and we've received that message for so long that even entertaining the idea that maybe there's some positive things about our body is almost too much initially, and it takes some time to sort of work through some of that. So I think there's a range of responses, and probably some audience members listening to this program may have had a negative reaction to the idea that I would just use the words body appreciation. I know I get that out in the world as some people have a negative response to just that concept. Condoning, I won't get into that more deeply, but yes. So I think there's a range of responses there, and I think it's important to, as an important step in situating what actually the goal is here. And I'll start to sound like a broken record because I'll keep returning to this, but this is, why are we doing this? Why make healthy behavior changes? Is it the numbers on the scale, or again, is this something that's going to empower your life in a wide range of ways? And I think if it's going to empower your life in a wide range of ways, that's a much different thing. And then it's a really useful stance to look at your body and say, my body really already does a lot for me. I can help it do more. I can help it do more.
Jason and I have been speaking about some things that I believe can change your perspective on weight loss. It's of special interest, as we've been telling you on this show, about our program that launches on February 4th, a virtual program that we call Fast 8. We invite you to jump on. If you haven't gotten the website down, it's timelesshealinginsights.org, timelesshealinginsights.org. If you've got a quirky browser or maybe a normal browser, you may need to stick www. In front of it. But you'll see the registration there for the Fast 8 program. You can download our handout, which I'm telling folks is a work in progress. We're incorporating things like the wisdom we're getting from people like Dr. Lillis as we put together the materials and roll them out for you. Absolutely no charge for the program. Jason, thank you for the whole show. I know you're a real busy fellow, running cross country and two professorships, associate professorships, and clinical research, authoring, working with patients. Thanks so much for joining us today.
Thanks for having me. I really enjoyed it.
Well, that's all for today's show. Hopefully you've gained some encouragement on some of the things that are challenging you. And as always, I'm Dr. David DeRose, wishing you the very best of health.